moment and emphasize how important it is to think about this with kids. You know, my initial training was in alcohol research until I met up Kelly and started doing this fabulous work with my addiction advisor, Will Corbin, and my eating advisor, Kelly Brownell. We came together and started doing this work. And one of the things that when we started thinking about this is what's different between something like sugar and something like alcohol. Well, if we think about alcohol, when early experimentation or exposure is most likely to take place is in adolescence or early adulthood. And that is even concerning because the brain is more malleable and more plastic, and heavy use of things like alcohol and marijuana at this stage can disrupt the normal development of the brain and make people more prone to the development of alcohol-related or cannabis-related problems. In contrast, if you think of these foods, there's exposure to this in the first year of life, in the first years of life. After the age of 2, a child is more likely to have a sugar-sweetened food or beverage on a given day than a fruit or a vegetable. So even if these foods have less addictive potential or potency than things like heroin or cocaine, given the early vulnerable stages of repeated exposure when the brain is just developing and habits around eating are just developing, this may cause the development of what looks like an addiction very early in life. And so we developed the Yale Food Addiction Scale for children to start to look at this. Surprisingly, in a community sample of children, these aren't children who were in treatment, these aren't children who we got from a pediatric obesity center, these were just children we recruited from the community. 7% of them met the YFAST cutoff for showing an addiction to food. On average, children were showing 2 symptoms. This is higher than what we actually see in adults, where we see typically on average across all people 1 symptom. Children are maybe showing more of this. Children with these higher YFAST scores had higher elevated body mass index, they were more prone to eat in response to emotions, they were less responsive to their satiety signals, and observing what they actually ate in our lab, even when we controlled for their body mass index, these children with higher YFAST scores ate more food. So I think it's really important when I think about what are some of the implications of this work, why does it matter, is thinking about children and infants, and how this may be setting them up for lifelong problems with eating. And there's also some potential evidence that there may be some cross-transfer to risk for other drugs of abuse.